Hey everyone, this is Dr. Stephen Gundry, and today I'd like to talk to you a little bit about Hashimoto's thyroiditis. Most of you, and particularly women, who have been told you have a low thyroid function, or have actually been told you have Hashimoto's thyroiditis, let's talk about where this comes from. I treat a whole lot of people with Hashimoto's thyroiditis, and every one of these individuals, when we test them for intestinal permeability, aka leaky gut, they all 100% have leaky gut. And what's fascinating is we know the mechanism by which leaky gut causes Hashimoto's thyroiditis. It's a mechanism called molecular mimicry. Basically, it means that when particles such as lectins, such as gluten, and gluten is a lectin, or other plant proteins, or even bacterial cell walls pass through a leaky gut, your immune system becomes activated and begins looking for these proteins elsewhere in the body because the immune system knows they're loose, they're through the wall of the gut. What's fascinating is that these proteins, in plants particularly, have a very similar molecular identity to other proteins in our own body. That identity is close enough that when your immune system is activated looking for trouble, and your immune system in this case goes past your thyroid gland, your immune system says, whoa, there are proteins in that thyroid gland that look a whole lot like the proteins that I'm looking for. They carry a molecular barcode very similar to what I'm trying to kill. It's not quite the same, but it's close enough that I should attack it. So this is called the molecular mimicry theory of autoimmune disease, and it correlates extremely well with what I see in my patient population. In other words, we see anti-thyroid antibodies, anti-thyroid peroxidase antibodies, anti-thyroglobulin antibodies, and when we seal leaky gut, and we do with the program, those thyroid antibodies go away. In other words, the Hashimoto's resolves. And that's the whole premise of what we do here at Gundry Health, resolving these autoimmune issues by fixing intestinal permeability and leaky gut.